Every so often, you look at the programme and there's a title of a talk that makes you stop in your tracks completely. So try this one. Gut-lung crosstalk in chronic respiratory disease. The gut-lung axis. Who would have thought that there is anything that's similar between the two organs? But there is, and the link is the microbiome, which, as we've said before, is the real hot topic of this Congress. So I'm delighted to be joined by Philip Hansbro, who's going to tell us a bit about this. It sounds completely bonkers.
Yeah, it is. It does come across like that, and we're often surprised by the results that we get ourselves. Some of them are quite remarkable, and you would never think that some of these experiments would work, but we do see a consistent differences when we swap microbiomes, and we can modify them to suppress the development of disease.
Okay, give me a bit of science here.
Okay.
So what can you do to the gut microbiome that has an effect on the lungs?
So, well, as you know, the gut is very well populated, heavily populated with bacteria. In many respiratory diseases, you do get some impact on the gut wall. So, for example, with smoking, that also affects the gut wall and can induce gut disease. And so that damages the lining of the gut. And because there are so many bacteria in there, they are able then to cross the gut wall, the bacteria themselves or their components and metabolites. They go into the systemic circulation and then can circulate around the body. And because there's so many blood vessels around your lung, in order to undertake the gas exchange, then any bacteria or inflammatory factors that are in the blood can directly affect the lung that come from the gut.
So are you telling me that if you change the microbes in the gut, you'll improve the lung disease?
Potentially, that's what we are trying to do, and we are trying to work towards new treatments that target the gut microbiome for chronic respiratory diseases.
Now, a lot of you are watching this and thinking, this man is completely mad. But can I just say in his defense that people with gut disease are known to have more skin conditions than people without gut disease. And if you have a very low diversity of microbes in your gut, you have a low diversity of microbes on your skin. And that's where the people who have skin disease. So it's not so very far-fetched. Why have we never thought about it before?
Well, most people and most clinicians, they evolve in their field and they study respiratory disease, and they're quite focused on that. And now we're taking a much more holistic approach as a field into respiratory disease, as well as, and many other fields are doing this as well. So the actual gut-brain axis is even more developed than the gut-lung axis. So we thought it would make sense to try and modify the gut microbiome and gut biology in order to try and influence respiratory disease. And another thing is that people have started to look at the epidemiology of these things as well now. So people who have smoking-induced COPD and emphysema are 2 to 3 times more likely to have Crohn's disease in their colons. And people with inflammatory bowel diseases, 50% of them have pulmonary involvement and inflammation in the respiratory tract. So we're trying to work out those mechanisms and how we might be able to modify those processes to develop new treatments.
It's an absolutely fascinating area. So thank you very much for coming along to share that with us. And if you are as intrigued as I am by the title of this talk and you want to have a look at it, please go to live at ERS Plus and you'll find it there.